and his mother, Jennifer, and I am happy to tell you that they are doing well today. Yet when we think about the impact of this epidemic, what we often don't understand is that the CDC, the Centers for Disease Control, shared that the national data in 2014 indicated that one baby was being born every 15 minutes with signs of NAS. What does it mean for how rapidly this epidemic has grown? The data from 2004 to 2014 showed that the United States had a 433% increase, meaning that 8 babies out of every 1,000 hospital births were being born with NAS. So, a typical baby is in the hospital for an average of 2 days for an uncomplicated birth. A baby born with NAS is in the hospital, usually in a neonatal ICU, for 14 to 17 days on average. A hospital expense of about $93,500, as opposed to $3,700 for an uncomplicated birth and delivery. What do we need to do about this? We have to overcome the stigma for these moms to allow them to receive treatment and care during their pregnancies. We have to have better research for early intervention. We need to be better capable at tracking these babies. We need to get consensus around the best practices. We heard about best practices earlier this morning. We need to understand the best practices to treat these mothers and these babies. We also need to come together around how to develop long-term models of care. And to do that, we need to continue to become more effective in partnership. Partnership between the healthcare providers, between our community and social services programs, between law enforcement, between our faith communities, and the communities that these families live in. But at the end of the day, we have to understand the long-term impact of NAS so that we can have a long-term plan to be able to be the voice for the voiceless in this epidemic, the epidemic and the opioid crisis. Please join us in this work, and thank you for being here.